an original.
From Story Studio Network.
The 2030 Project is a Story Studio Network podcast sponsored by Daily Bread Food Bank, a Toronto-based charity whose mission is to collaborate with all to eliminate food insecurity and advocate for solutions to end poverty. What would it take to eliminate poverty in Canada by the year 2030? This is the 2030 Project. It's a podcast that explores why poverty persists and what we can do about it in this country. We endeavor to uncover what's been successful with Canada's poverty reduction strategy, but then what needs to come next? The 2030 Project tackles some of the biggest and the most pressing social issues facing this country today. I'm Dave Trafford, and thanks for joining us. In this episode of the 2030 Project, our focus is shifting from the public health crisis to what is now a looming hunger and poverty crisis. And whether it's the lingering effects of the COVID-19 pandemic, the Russian war in Ukraine, extreme climate events, inflation rates and interest rates around the world are driving up the cost of living, driving up the cost of everything, from groceries and energy to transportation and housing. Diane Dyson is the Vice President of Advocacy and Research at Daily Bread Food Bank in Toronto, and as dire and as difficult as things may be for many people, Diane notes it's only serving to heighten the urgency around the discussion of poverty.
Poverty as an idea of how our neighbors are doing was a kitchen table conversation.
Neil Hetherington is the CEO of Daily Bread. He actually heard that heightened discussion shortly after we completed season 1 in the fall of 2021.
It was a month or two after the release of the final episode that I was speaking at a school and found out children in the grade 10 class had to listen to episodes of the 2030 Project.
What I found encouraging, because we had already started to talk about the framework of this particular season of the 2030 Project, and I came back to it thinking, okay, well, if we agreed that we should probably start this by expressing it through the values of the Daily Bread Food Bank, and I thought, okay, that's kind of interesting. But to your point, when I heard that political prioritization discussion change, become that much more intense around it, I thought, oh, okay, then this really is about literally and figuratively a kitchen table discussion, and brings us right back to the whole idea that, at Daily Bread, you believe that, access to food is a right. And it sounds so obvious, but here's the scary part about it. We have to say it out loud.
And I think one of the reasons that it became a kitchen table conversation is that people could finally see themselves in it, that they saw rising expenses, that it was more than just other people who were going to be facing challenges. And so it became a conversation that rose to the top because we're in a scary time right now. We've gone through a scary time. And what we're trying to do is figure out, what does Build Back Better mean?
So, Neil, let me ask you then, because if we get into that discussion about we went through a scary time and there will be learning moments that we can point to from COVID, and I think we've seen behavioral changes that are positive. But now, Diane points out this is really hitting more people than we would have otherwise thought. They may not be going to the food bank, but they're taking a double take when they go to the grocery store, because inflation being what inflation is, that we haven't seen in a generation, all of a sudden this whole idea that food is a basic human right takes on a whole different context around, I can't afford the food anymore.
It is absolutely hitting home for more and more people, and I see it all the time in line at the Daily Bread Food Bank with the clients that we're serving. These are individuals who are, they grew up thinking that whole mantra that if you go through high school, you get educated, you play by the rules, you'll be able to get a job and be able to support your family. And that's not the case. We see a lot of working families, more and more working families who are coming to rely on food charity rather than having the ability to have their right to food being realized by having the incomes that are appropriate for them and their family, because they're expensive. expenses are just so dramatic. We're in a period, we had COVID, we've got inflation, you've got housing, a lack of affordability when it comes to housing. These are all coming home. And so, parents are having conversations with their kids, assuming that they, or I don't know, maybe they're going through college or university and thinking, okay, they'll get that first job and soon they'll be, getting that house with a white picket fence. That's not a reality for the vast majority. And so I think we're having those conversations and saying, well, what is it that needs to change? Why is it that there isn't that housing affordability? Why is it that there isn't the income security that people need in order to get by? Why is it that, a full-time job doesn't mean that you have an income that will support even some of the basics? And so that's where, regrettably, Daily Bread and food banks all across the country have stepped in because there is a shortfall.
Well, I think there's the interesting thing that you guys published recently too was that research out of the University of Calgary, Diane, and the direct effect of government policy on people who live on the fringe, on the margins, right? Who are just teetering on the brink of poverty. And to me, as harsh as it might sound, is that COVID was just sort of the beginning of this discussion. This inflationary, maybe recessionary period that we're moving into might be, I hate to say it, but might be the thing we need to accelerate that conversation even further.
I think you're right. It takes a lot of political courage to change some of the substantial policies that government puts out around housing, or around employment and labor. That I think what was interesting about the research that we did in February is that we were able not only to draw the direct correlation between specific government policies on social assistance, on minimum wage, on affordable housing, and rent control. We were able to quantify it. We were able to find out that for every $30 raise in rent, an extra 73,000 visits happened to food banks in Toronto, 375,000 more visits across Ontario. It was that kind of quantification, I think, that moved us from the general angst that people feel to say, here's something that we can measure and move forward on. Food banks are acting like the canary in the coal mine. When the other government systems fail, people end up at our doors. Mm-hmm. And if we want to close food banks, if we want to make us obsolete, we need to make sure that people can earn a decent living, have income supports when they're not able to work, and can afford to live in a house where they've been over time.
So, and we're going to get into this in subsequent episodes of the series. But Neil, I think there have been things that we have noticed. I have anyway. In the last 6 months, since we wrapped up the first session, and we thought, okay, well, here's where we are in terms of the pandemic. Here's where we are in terms of the poverty reduction strategy. What are the possibilities? And more often than not, I'm talking to people, and you're a good example of it, where when you had to shut everything down in the first lockdown, you pivoted quickly and you broke the system and recreated it in a hurry to make sure that people weren't left behind. And you weren't the only one to do that. There were lots of services that managed to do that. So I'm curious to know, CERB, for example, is a really good example. And you can kind of look at the U of Calgary's work that they've done and see, there was government policy that had a direct effect on people's ability to feed themselves in a moment of crisis. Is there, as a result, I want to call it low-hanging fruit. Is there a place where we can go and say, okay, we've got best practices already demonstrated here. Where is it that we should be? Where's the first point of attack here?
Well, I think going to Diane's point, it takes political courage. And for years and years and years, the Daily Bread Food Bank had a fantastic advocacy and research department that was presenting solid policies that we knew were kind of the right thing to do. They were based on values that I think we can all subscribe to, and they were decent social policies. And then, with that research that we brought out, it took it to the next step where we could hand a gift to government and say, if you want to decrease the number of people who are on disability who have to make use of food charity, here's what the direct correlation would be. So we mentioned one statistic in terms of what is the effect of $1 a day on increase on rent. What would that result in? And in Toronto, that was a horrible number of 73,000 more food bank visits. But conversely, the hopeful one was just, a $15 monthly increase to disability would have, now this is at the time of the report in February, would have an effect of 56,000 fewer food bank visits. So we've been able to articulate policy. We've been able to articulate what the cause and effect are. And now we've packaged it up and we've literally handed it to the premier and said, we want to walk with you in this journey to be able to implement these policies. We know, I can't imagine what would have happened across the country if CERB hadn't been in place. Mm-hmm. At the same time, there's a part of me that says, why is it that we said you need $2,000 a month, but somebody on disability needs $1,169, and that's the standard monthly payment? Why was it that we said that was the right amount to be able to give? I think intuitively we knew. And I think that when we sort of shine a light on that, as Daily Bread has done, as the media has done, as conversations around the kitchen table have happened, and it has worked its way into political platforms, we recognized that what we were doing in terms of income assistance was counter to the values we espouse.
So given that, do you think, Diane, that our perception or our understanding, maybe more importantly, of poverty has shifted over the last 2.5 years?
I don't know if generally people understand that poverty is an assault on an individual in so many different ways, that their housing is too expensive for them, that they might not be able to afford that winter coat, that transportation is a daily cost that often they will aver. I think that poverty is complex enough that even sociologists and other people who study it have a hard time with it. But what I do think happened is that through COVID, people began to recognize that there was this inequality, that some people had an easier time during COVID than others because some people were able to stay home, some people had to go to work, some people lived in apartment buildings where you were more likely to catch COVID, and others were in detached. So I think that stark division became clearer to all of us. And the other thing that I think that happened is that people who had privilege began to see people who were working outside their homes, realizing the important contributions that they were making to our society, that they were keeping our factories going, that they were making sure we were fed, that buses were running. There was suddenly a new respect for any of those on the ground essential workers, working class, the PSWs who had to show up. I think that those were two clear lessons. That we are still in an unequal society, and that there's some people that the people that are doing those basic jobs are really important. And I think that was an insult to our own sense of fairness that we have as Canadians, that everybody should have a fair go at it, that we respect each other, and suddenly we realize that's not the society that we're living in.
Well, okay, then, if we look at it from that perspective, and I think it's an important one, we changed our perspective in terms of that level of equity. Neil, this is, again, go back to low-hanging fruit. This is an area where government can step in and say, great, here's what we learned. If in fact there was a lesson here, have we learned from the lesson, i.e., people who worked at the major distribution centers and, moving goods around and all the supply chain issues that we faced, they had to be in the office or in the warehouse. And those were ground zero for so many outbreaks of COVID-19. It brought up the question of sick pay. That's one. And the idea that, we've got nurses in this province, here in Ontario particularly, who we're all out there banging pots for them at the beginning of it. And the Premier saying he is so supportive of them, frontline healthcare workers, yet we limit their pay significantly based on all of that's going on. There's a disconnect there. Now, I would think politically, I'm not going to ask you to do this, but if I were advising them politically, that's an easy answer. It's an easy solution. Sick days are mandatory. We're going to make sure that that's covered, and our nurses and our frontline healthcare workers are going to be taken care of properly. If they don't do that, I think your whole argument about courage kind of goes out the window.
Well, I think it's easy, and my hope is that they're listening to you, Dave, because it's also a popular thing to be able to implement. Those that you mentioned some policies which will benefit a tremendous number of individuals who are working on the front lines. I think that it is a popular notion and platform to be talking about the development of decent, affordable housing, not only for the individuals that are making use of it and find a new home, but think about it from just how communities thrive. That you're able to find the workforce that you need for the small business that you might have. You can't do that unless people have decent housing nearby. That there is a decent transportation system in place so that your business can thrive. They work together, and I would say that it's important for us to do this because of the values that we regularly talk about, but also because it will foster creativity and innovation that will start to drive the economy even in a more robust way.
Diane, do you worry that now that we've kind of come through the worst of COVID, that we're so fatigued? Then we saw that, I think, was reflected in the voter turnout in Ontario. It was so low. It was anemic at best. That we're tired, that we are fatigued, and we recognize that our healthcare workers need to be taken care of, that these essential workers need to be taken care of. But the fight's out of me now. I don't have the ability or the patience anymore to stand up on my hind legs and bang my fist on the table and say, let's get this done.
Yeah, I think that is a strong public sentiment right now. And it may be because we have spent a long time supporting each other, bike brigades out bringing food to seniors and all of us checking on neighbors and those sorts of things. So it has been a long, hard 2 years. But I think it also goes to, and this is a question that we will wrestle with, is about what is our belief in the role of government? Do we think that government is them who makes rules about our lives, or do we understand perhaps that government is actually what is our common agreement with each other, that social contract? What do we owe each other? But it has been such an exhausting 2 years where we've talked about rules and regulations and things like that we probably need to take a pause. But I don't think that relieves governments as they're being elected now from continuing to push forward, because they've seen that the difference that it's made. The evidence is clear that government needs this. We need to see leadership now stepping out to make the changes that are needed.
Well, interesting, you talk about that sort of that evidence-based decisions, and that lends itself to one of the values described by the Daily Bread Food Bank, is that probably more than ever, Neil, we have evidence-based solutions. Evidence-based anything has become more of the vernacular since we started into the COVID pandemic. We've all become, off the side of our desks, epidemiologists and we're lagging indicators and all those phrases that we're throwing around, that we really do want to see the homework being done. So I think the positive is here that we're all in that mindset culturally. And to your point, you guys, whether by accident or design, put the University of Calgary research on the table and said, okay, there's evidence-based. I think there's an appetite now for that change. Whether I'm exhausted or not, there's an expectation that we're going to act on it.
Well, that's our hope, that they act on it. We gave them the evidence. We're going to continue to push that through every channel possible. We have we had recently the opportunity to have Torontonians sign a petition. And that petition was to have the government act on the implementation of initiatives that would result in poverty being reduced. And it was handed to them this past holiday season. And we had 27,000 Torontonians sign this petition. And uniformly, people believed, in a right to food. That doesn't mean free food handed out on every corner. It means the ability for somebody to be able to purchase or get their food that is appropriate for them and their family and their culture and their health needs. And people rallied around that. And so I constantly am looking at these strands of hope that whether it's the pandemic or research has that is, making the news more and more. People are talking about this as systemic issues. They're not talking about it just as food bank visits. And that gives me hope that we will make those changes.
Well, and I think that the whole idea of what we're going to do in this series, in this season of the series, is to say there are solutions there. And I think we have learned, whether it's from our observations during COVID or just the natural way things have happened over the last couple of years, it has heightened our awareness around it. And so I think that we're in a place where we can probably more optimistically, Diane, say that there are solutions. And for example, we're going to get into this whole conversation about access to food, about food deserts, and the idea that it's not, maybe it's government getting out of its own way and allowing communities to plan accordingly based on what communities need. So maybe there's more of a conversation that has to go on there as opposed to reliance on government to take a very rigid role, for example, in, community planning.
I think what government is useful for is that it can help set the standard of what's the minimum base that we expect, and then moving out of the way to let community and local people to reach and design what that looks like. It's a little bit like what the Canada Health Act does, where it says to each of the provinces, you need to deliver this much care, but you can go and decide where the hospitals are, for instance. So I think it's got to be a conversation back and forth. But what we do want is to make sure that it doesn't matter which part of the city or which part of the country you live in, that will shape and limit what opportunities you might have.
Yeah, well, and that's a tall order, though, right? I mean, just being able to say that taking the
it's
regionalized
an work.
Well, yeah, it is a lot of work, and to be able to say, you start breaking it down regionally, or just in terms of First Nations communities, they have a whole different kind of a need there in terms of their relationship with government. Holy cow! So to say that it's complicated is probably understating it. But as we move through this, and I'm just we'll close on this, but I'm curious to know if there was a behavioral change that we saw in the last 2 years that you think, yep, that turned into a positive, that we should carry that forward, that you might not have otherwise expected, Neil?
I think we became a kinder, gentler society out of the pandemic. People recognized that poverty or inaffordability is closer to home than they thought prior to COVID, that they saw their neighbors struggling, that they asked questions about systemically why is that occurring, and so if we hadn't changed as a society, we wouldn't have had an election where all four parties were talking about affordability, we're talking about disability, and we're talking about social policies, all four. And so I will hold on to that, but I won't get lethargic in terms of just allowing it to go. I think we need to continue to beat the drum. I think that, yes, we might be tired, but the need won't go away by us being tired. And so I think that it is imperative for organizations like Daily Bread and each of the guests that you will have on throughout the podcast to be articulating clearly what needs to happen and be willing to take the courageous actions to implement it.
Well, many of them will be front lines in terms of, providing the services. And a few of them are going to come back from season 1. So I think my goal, Diane, will be to challenge them to say, all right, I know you had a hard time during COVID, but surely you learned something that, you're taking with you that's positive, that actually makes what you do more accessible, that makes what you do more efficient. So I'm going to be curious to hear how that plays out. Leave us on your optimistic note. What was the learning that you noticed?
There was a recent Angus Reid poll that over the years has always measured what are Canadians' values. And it was in this year that they found that there was more specific support for the, quote, the poor, the disadvantaged, and those in economic trouble. And that was counterbalanced against a decline in those who believe that the system rewards hard work and initiative. I think it's that kind of insight that actually will give the courage for all of us to keep going, whether we're tired, whether we're in a new leadership position. I'm hopeful that people have had a peek under the covers and now see that we still got a bit of work to do, and so we'll keep on doing it.
All right. Well, we'll get to work on some of those questions, some of those answers, and I'm anxious to hear what some of the solutions that we stumble upon. Neil Hetherington and Diane Dyson, thank you.
Thanks, Dave.
Thank you.
Thanks for listening to the 2030 Project. We would encourage you to subscribe to the show. We're on Apple and Spotify, Google, Audible, pretty much anywhere you get your podcasts. We'd also be grateful if you'd offer a rating on the show. We'd love your thoughts, your feedback, even your criticism. The 2030 Project podcast series is sponsored by Daily Bread Food Bank, a Toronto-based charity whose mission is to collaborate with all to eliminate food insecurity and advocate for solutions to end poverty. I'm Dave Trafford, and the 2030 Project is a Story Studio Network podcast produced by Eye Contact Productions.